Now, apparently you formed some opinion about the component parts of the Sargon implant based upon that incident you previously described when you saw a dental student working vigorously to remove a temporary restoration. Is that accurate?
Accurate.
Okay. And that is the only time that you've ever seen any work take place in regard to a component part of the Sargon dental implant. Is that correct?
Correct.
So the totality of your personal experience or personal observations in regard to the component parts of the Sargon implant involve that one incident involving the student. Is that correct?
Correct.
Okay. As I understand, you don't know who that student was. Is that correct?
That's correct.
Do you know if that student received any training in the Sargon implant system?
I don't know. No.
In the course of your observation of the student working on that temporary restoration, did you ask anybody if the student had any training in the Sargon dental implant system?
No.
Do you know what type of cement was used on that temporary restoration?
No.
Do you know if in fact the restoration was affixed by cement or screws?
Do I know? The answer is
yes.
no.
Did you ask anybody?
No. Oh, it was cemented. To the best of my knowledge, it was cemented.
How do you know that?
I just think it was cemented.
Based upon?
Based upon recollection.
What about your recollection leads you to believe that it was cemented?
I just recall that it may have been cemented.
Do you know what kind of cement was used?
No.
Do you know if the Sargon dental implant system calls for any particular types of cement to be used in affixing a temporary restoration to the implant?
Objection, vague and ambiguous and lacks foundation.
No, I don't know.
Have you ever taken any steps to determine whether or not the Sargon dental implant system calls for the use of any particular type of cement in respect to temporary restorations?
No.
Have you ever personally had any difficulty removing a temporary crown from any Brandemeier Noble BioCare implant?
Yes.
Have you ever observed any other dental practitioners ever have any difficulty removing a temporary restoration from any Brandemeier Noble BioCare or any other type of implant other than the Sargon implant?
I think you mean Brandemeier. Is that what you meant? Brandemeier.
Brandemeier, Iceberg, Ginsburg, they're all the same. It's Brandemeier, M-A-R-K. Have I
ever observed any other dental practitioner have difficulty removing a temporary restoration from a Brandemeier, Noble BioCare, or any other type of implant?
not of the difficulty that I saw this student have.
What was the nature of the difficulty that student was having?
He could not remove the provisional.
Do you know why he couldn't?
No.
Did you ask anybody why he couldn't?
No.
Did you make the determination that he could not remove it because of some problem with the implant?
Objection, vague.
No, the implant seemed to hold up quite well. I wasn't commenting on the implant.
Okay. Did you assume that the difficulty was due to some problem or deficiency with the prosthetic device?
Yes.
Why did you make that assumption?
Because ordinarily, when you remove a provisional from the ones that I've been accustomed to, they don't require banging.
Well, do you know if that was a problem with the prosthetics or a problem with the manner in which the restoration was originally put on? Was there a problem with the device, or was it a problem with the manner in which the dentist who put on the temporary did his job? Do you know?
I don't know.
But you apparently assumed it was a problem with the device and not a problem with the manner in which it was put on, correct?
Correct.
Why is that?
Because in my experience with the implants that I've worked with and some others that have come in as a transfer patients, it's quite easy to remove the provisional without having to resort to the real knocking and banging that was going on in that patient's provisional.
But you had no prior experience at all with the Sargon dental implant, did you?
Correct.
Now, I want you to describe in as much detail as you can exactly what the difficulty was that the student was having. What was the student doing, and what was the problems that were being encountered?
Objection, compound, calls for a narrative.
Okay. What was the student doing?
He was using a device, it may have been a crown remover, and he was banging on the provisional. I mean, the instrument was banging on the provisional.
You called a device which may have been a, what'd you call it? A crown removal?
Mm-hmm.
Are you sure that's what it was?
No.
Do you know how many temporary crowns that student had previously removed from any kind of implant?
No.
Or from any patient at all?
No.
Did you ask how experienced that student was?
No.
Well, when you saw this happen, you say, hey, what are you doing? What's the problem? Anything like that?
No, I didn't.
You just observed him having difficulty and assumed that it was a problem with the prosthetic device.
Correct.
If the wrong type of cement is used in affixing a temporary restoration to an implant, it's too hard. Will that make it difficult to remove the temporary restoration?
Objection, incomplete hypothetical, calls for speculation. It's vague and ambiguous. Lacks foundation.
Do you have an opinion on that score?
I don't have an opinion.
When you saw this incident, did you go to Dr. Landesman, or do you speak with Dr. Landesman, or Dr. Chi, or Dr. Nazari, or Dr. Lazaroff, and say, hey, I saw a student having a problem with restoration. What's going on?
No. I may have said, in retrospect, I may have said to Dr. Chi that there's some student over there that's really having a hell of a time getting the provisional off. But Dr. Chi was not standing over he was definitely not at the chair. But in the course of walking out, I may have said, geez, that guy's really having a hell of a time.
Did Dr. Chi ever mention to you that there were some difficulties that were being encountered in removing temporary crowns from the Sargon dental implant?
No.
Did you ever ask him if there was some generic problem in that regard?
No.
You do know that there are different types of cement that can be used in regard to the placement of a temporary restoration. Is that correct?
Correct.